Hey everyone, if you're new here, welcome. My name is Marchelle. For those of you who don't know, in today's video we are going to be talking about dental hygiene. So for those of you who don't know, I have been a dental hygienist for the past 7 years. This upcoming year in 2024 is going to be 8 years, guys. Like, what? I don't know how, when, or where we got to this point. I graduated dental hygiene school when I was 20 years old. So you could just guess how old I am, okay? Because I'm not about to tell you my age, okay? I'm a lady. I'm a lady. So yeah, guys, it's been almost 8 whole years of dental hygiene. And I have pretty much gotten my feet wet real good in this field. So I'm going to be coming to you today with a Q&A, so a question and answer all about dental hygiene, okay? So it'll be some good insight on dental hygiene. So if you're currently in school, if you are planning on going to school, if you're already in the field, make sure that you stay tuned to this video because we are gonna get into it, okay? All right, y'all. So the first question is how many patients a day do I typically see as a dental hygienist? Now guys, this obviously depends on how many hours you work. So I'm gonna base my answer off of a typical 8-hour shift, right? So let's say we work 8 hours. Now, I know every office is different, you guys, and the amount of time that you get per patient depends on your office. It depends on what they require from you in a new patient appointment. In my office that I'm currently working at, and typically offices that I've worked at in the past, I have about 80 to 90 minutes for a new patient. The reason why I have an hour and a half for these new patients is because the amount of things that my office is asking for in a new patient exam. Now, you might just have a patient who's just coming in just for basic prophy, and that's also based on your office and however long they allow you to have prophies. I have seen them anywhere between 30 minutes to an hour for just a prophy cleaning, which is a regular basic cleaning, an exam, maybe some x-rays. Also, you might just have an appointment just for sealants, or you might have an appointment just for scaling and root planing, or just like a deep cleaning, or just for a gingival scale. So all of these things can be different times depending on your office, okay? I'll tell you, for me, deep cleanings are about an hour. For sealants, depending on how many, I'll probably schedule sealants about 30 minutes. For kids, you know, kids are shorter appointments. We usually schedule them 30 to 40 minutes depending on if they need x-rays or not. You know, all of these things vary, right? But typically in a day, you'll probably end up in an 8-hour shift seeing anywhere from like 6 to 10 patients. Because what if you have just a bunch of kids on your schedule, or if you just have a bunch of prophies, so regular cleanings on your schedule? You know, it varies. Now, I have worked in an office, which is forbidden to me. I would never ever go back to that office. It's insane. But I was seeing about 20 patients a day. If that is you, if you are a new hygienist and you are currently practicing that way, where they're making you see about 15 to 20 patients in an 8-hour span, that is about, or 8-9 hours, I don't care, like in a day as a hygienist, that is too much personally for me. And especially if you are a new hygienist and you don't know any better, that is going to cause burnout, okay? So you're going to be burnt out, you're going to be exhausted, unless you like it, because I know that some offices like that, they come with good bonuses, stuff like that. Hey, to each its own, unless you like it. But if you are in that situation right now and you feel a little bit weird about it, and you're like, is this regular, is this normal? I will tell you, it is not. Leave. Run, run, run. All right, y'all, on to question number 2. How do you stay on time? So that's a good follow-up question, because depending on all of these things, right, that your office may be requiring you to do. So one of the first ways that I stay on time is in my office we do a morning huddle. So in a morning huddle, I really like it because you can identify areas in your morning huddle. So a morning huddle is kind of like a short team meeting where you talk about and you discuss your day and your patients for the day. So you in that huddle can identify what areas you may need help in, and you can go ahead and give your team members and your doctors a heads up. Hey, you know, this patient right here at 11, I know the last time she came in, she needed more emotional support. She was maybe a little bit more chatty, or she was more nervous. Maybe she needs nitrous, you know. Those types of things can delay you. So if you identify that in the morning at your morning huddle, even if your office doesn't have that implicated, at least relaying that message to your assistants in the office, to your office manager, to your doctor, somebody, you know, that can help you to take charge, so that when that patient comes in, you know, your team is aware or your manager is aware, and they can say, hey, you know what, let me go and grab someone for help for the next patient. Let me have something set up, or a separate room set up, so that if you go over with that current patient a little bit, your team can help you out. So that's one way. My second way, which is really the first things, which is really like the first thing, okay, is chart preps. Okay, making sure that you are looking at your patient's charts and their notes probably at least a day before they come in. If not, I would say at least 2 days before, because then that way that gives you some time. Like if things just aren't adding up, if things, you know, like say you have a patient scheduled for just 40 minutes and they do need extra time, they need that TLC, that tender loving care, they need you know, some extra wiggle room, they need nitrous, they need just, you know, for you to take more time with them, then those are patients that if you can see that 2, 3, 4 days ahead of time, you can give that patient a call and be like, hey, you know, Miss so-and-so, like, would you be able to actually come in at this time, or would you mind if we push your appointment to this day, just so that I have enough time for you, you know? And it's more fair to do it ahead of time and to give your patients a heads up versus just looking at it the day of and then being like, oh, maybe we shouldn't have done that, let me call her, you know, because that's not fair. Maybe she had moved around her schedule, had like already made plans, you know, for this appointment. But just looking ahead, looking at your chart notes, reading your notes, remembering who your patients are, and treating it as so that you can stay on time. Because again, this is all about these certain patients that we have, that we are responsible to take care of. Some people just need a little bit more TLC, and that is okay, but we should make sure that we're setting ourselves up for success and not failure. My other way that I save time is that when I am perio charting, so this is when you're measuring your patient's gums, and you have to record a lot of different numbers when you're measuring your patient's gums. You know, if you're in the dental field, you'll know what this means, but this is just basically how we check our patients' gum health. We have to do measurements. Now, if you're recording the measurements on your own, it's going to take longer. So what I do is, you know, especially when I have a new patient or when I'm doing my chart preps and I notice that I have a patient that's due for perio charting, I go ahead and I let someone know. Now in my office, we are fortunate, we have a hygiene assistant. Some days she's not there, some days, you know, she's out sick or whatever. I have to communicate that with someone else in the office, and I have to say, hey, would you be able to at 11:50 be free to help me out? And this is something that everyone in the office can do. All it is pushing numbers on the keyboard. So you say 3, they recorded 3. You say 2, they recorded 2 for you. So anyone can do it. The manager can do it, the girls at the front desk can do it, another hygienist can help you, the assistants, anybody in the office can do this besides our patients. Okay, we won't use them up like that. I can get someone in the room with me to help me out and say, you know what, this is what it is. We also have radios at my office, so that saves so much time, you guys, because instead of me having to go search for the doctor or wait for the doctor to be done with his procedure, because I obviously don't want to walk into doctor's procedure and interrupt them while they are with a patient, and I don't want to do that because they're with a patient. When you are with a patient, that patient is most important. You should have tunnel vision to that patient. So you don't want another team member or yourself talking about another patient in front of the patient you are currently with. That is like a no-no. So I never want to go into that procedure room that doctor's in and be like, hey, you know, like, we're ready, you know, because then once he gets up, that patient in that chair automatically may feel, you know, less valued, or like, okay, now he's taking away from my time. So we wear radios and it saves so much time. I don't have to wait outside the room. I don't have to, you know, search for the doctor, search for whoever I need. I can just radio, hey, can we have an exam in room 3? If your office does not wear radios, it is something that I would encourage to incorporate. They are annoying. Radios can be very annoying. It's in your ear, it's slipping out, people are talking, da da da. So we talk a lot in my office about radio etiquette, you know, and keeping conversations over the radio short. If you have something too much to say, go and find the person. But if it's something short, I need an exam, hey, can so-and-so, can you come help me out? You know what I mean? Or, hey, I'm ready for checkout. Things like that, then yes, let's talk over the radio about it. So that helps me so much. And then the last thing that helps me to stay on time is set yourself up for success. If you know that your patients are going to need x-rays, or if your patient has an implant, which you should know when you're doing your chart preps, you can go ahead and have your trays set up and ready for those particular situations, so that when the patient comes in, you have everything accessible. Keep your drawers in your room stocked so that you're not getting up out of the chair, going to get things that you need. You have it all right there in the room, stocked, okay? You have your trays ready and prepared. So preparation. Also, you know, as you practice more, the quicker you get at things, okay? So you should be striving to take full mouth series within 5 to 7 minutes. You should be, you know, a piano is very straightforward. That should take no more than 2 minutes. If your office does incorporate iTero scanning, you should be practicing to get that under 5 minutes. And this all just takes practice, you guys. So don't beat yourselves up. If you're a new hygienist, if you're in school right now, if you're just learning, it will come to you. I promise. But practice makes perfect. So again, don't beat yourself up over it, but it is something to strive for. And when you're just starting out, sometimes putting a little timer on yourself helps, okay? Using your teammates in your office. Someone's due for a full mouth series, say, hey, let me take your full mouth series. Practice makes perfect. If you're in school, you already know you guys are practicing. Don't beat yourself up, but strive for greatness. You got it. All right, guys, on to the next question. So the next question is, I had someone ask me, how do you deal with pain of being a dental hygienist? You know that we're more susceptible for things like carpal tunnel, back pains, God forbid, I don't even want to speak it into the air. Back pain, stiffness, stiff joints, all of this stuff. So how do I deal with the pain? You want me to be honest? Baby, saved by the alarm. Okay guys, so let's get into it. Dental pain. But you know, we're literally like this all day long, you know, in our patients' mouths, bent down, and sometimes we can't see, so we're like this and like this. So it gets crazy. You have to be careful with your posture. You can't be doing all this. You gotta remember that your patients are only there temporarily, and you have to do this all day long. So I have to remember to tell my patients, hey, turn your head. And sometimes I'll just, you know, slightly help them along, like with their jaw. If I need them to turn a little bit more, I'll just, you know, just gently like, hey, can you turn to the right? You know, can you turn to the left? And just remembering to do that, because they're only in the chair getting their teeth cleaned for about 30-40 minutes. And you are practicing this all day, and you are doing this job all day. So your comfort is what's most important, guys. Adjust their chairs. A lot of patients, they'll complain, oh, I can't lean back, I can't do this, I can't do that. I'm sorry, but like, you know, this is only for a temporary thing, unless, you know, obviously they're older, they have disabilities, those things we understand, right? But some people are just like, oh no, I don't like laying back all like that. Well, I'm sorry that you don't like that, but if you want to get your teeth clean, I don't want to break my neck doing it. I need to lay you back a little bit more to where it's comfortable for me. And just finding ways and good verbiage to talk to your patients in a nice, respectful way, and in an understanding way. You know, you go to sleep at night, sweetie, lay back, come on, you got this, you can do it. So yeah, guys, that's that. But definitely make sure that you're stretching, make sure you're getting massages. And I have not personally went to a chiropractor because I am deathly afraid, but I know that that's also, you know, an option, you know. And of course, we have to listen to our bodies. If we know that things just aren't feeling well, take time away. Even if you're in the middle of your cleaning, step away, get up, stretch your body, breathe, you know, do some movements, you know, stretch it out, and fix your posture. Fix your posture. Fix your posture. I know that getting loops helped me, and I know that they encourage you a lot in school to get loops. Loops are just basically a different type of glasses that we can put on, and they have magnifiers, and they the way that they adjust your loops when you first get them, they adjust your posture to be pretty good. So having loops helped me a lot, because when I first started, I did not have loops. So yeah, guys, make sure that you drink your water. I'm not sure if that has anything to do with pain, because I'm not a doctor. I'm just a hygienist. I'm just a girl. All right, guys, so I'm gonna go over about 2 more questions. I feel like I've answered this in any dental hygiene videos so far that I've done, but again, salary. Everyone wants to know, how much do you get paid? How much do you get paid? And I don't blame you, because I would not be in this field if I wasn't getting my paper, okay? We ain't just going to work because we love it. We're going to work because we love it. We get to take care of people. We make people happy. We give them beautiful smiles, and because it pays good, okay? Now the order of what that was just the list, okay? That was the list. But the order, that's tea. That's tea. That's tea. I'm not picking the order, okay? But salary, okay? So this also depends on, you know, where you live. But if you're in a bigger city, or the closer you can get to a bigger city, the more money you're going to make. 8 years ago, I was only getting paid $27 an hour, and now people that are graduating, I can only imagine that they're probably getting about $10 more, probably 37, 38, 40s even. You know, it just depends on where you live. And not only that, but it depends on, you know, your confidence and your confidence in your ability. If you know that you worked hard in school and you're confident in what you do, ask for more. Like, ask for more, for real. Ask for the highest amount and settle, you know, still high. That's what I would say. You know, you can still settle high. But the salary is, I would say, anywhere between $75K and about $120K, okay? That's like what I would say, okay? Let me actually look it up, because let me not lie to you guys. Let me not lie. That's based off of me. Like, from me, In my area where I live, I would say that the you know, if you're coming straight out of school, you're probably gonna make about 80K or more. And then, you know, if you have experience, you can get, you know, somewhere between 80 to 120K. It all depends, honestly, and everyone's paying different. If you do temping, you're gonna get paid even more money. Me personally, I'm not a temping person. I've done it in the past, but I like stability. So I'm not a temper, but I know that they get paid really, really well. You know, some offices are, you can go in there and you can make freaking $600 a day, and that's for 8 hours. So, you know, some people, I had a temp come to my office because one of the girls were out on vacation, and she was telling me how there was some app, and I don't remember the name of it, stupid me, but there was some app that she was on in Atlanta, and you know, they were doing emergency dental hygiene. They needed somebody ASAP. They would post it the night before, and it would be like $92 per hour. So I was like, girl, sign me up. But you know, silly me, missed out on that opportunity. Haven't seen the girl since. So let me see, I'm gonna look it up really quick for you guys. Let's see. Online right here, when I looked up dental hygiene salary, it pulled up my area, which again, I live in Atlanta, and it says anywhere between $37 to $54 per hour. That's what it says, but honestly, I know that people are getting less, and I know that people are getting more. So that's the range for this area. But I want to see kind of in general. Let's see, average USA. So it says in the United States, entry level is getting anywhere between 47K and 74K. That's what it says on Google. But I would say you're probably definitely gonna start at least at 70K. That's just, you know, a lot. And then it says, yeah, this sounds more right. It says the average salary for a dental hygienist per hour is about $47.98. So that sounds about right to me, you guys. So, you know, and then it's all based off of your experience with things. So, you know, the more experience you have, the more money you should be making. And if you're not, know your worth, period. Guys, so I guess I'll answer one more question. Let me answer. So the last question is going to be corporate or private office. Corporate or private? I personally work for a corporate office, and the corporate office that I work for here in Atlanta, even though I'm new here, I also worked for this same company back in Pennsylvania for almost 5 years. So in total, I have about 6-year experience with this company, and I feel a little bit of bias for this company. I like it. Now, with that being said, even though I worked all these years with this company, so almost 6 years with this company, I went through a phase where I had like a year off, and I worked a bunch of different dental hygiene jobs, guys. Temping, I did part-time, full-time, I even worked on a bus. And I worked on a dental van, you guys, like, but it was a hooked up dental van. It had Wi-Fi, it had Bluetooth speakers, the chairs were massage chairs, like they did it all up in that dental van. So I have gotten some good experience, and from everywhere that I've worked, I prefer corporate office. And the reason why is because corporate comes with benefits. You can get bonuses when you work in a corporate office, so you have opportunity to make more money. You have more opportunity for growth depending on how you want to grow, because in dental hygiene, there's not too many different things that we can do. So at least when you're in a corporate office, you have some opportunity for growth, because they're always growing. So, you know, they might have, it depends on what company you work for, of course, but they may have some teaching opportunities for you. I know that at my office, they have mentorship, like dental hygiene mentor, where you can, you know, be a mentor to other hygienists in the company. Maybe there's someone brand new starting and you can, like, you know, work with them one-on-one, and, you know, you can just basically be a mentor and an advice giver to someone who needs your help. So I like corporate. I favor corporate. I also like corporate because of the whole bonusing system, and because they want you to basically be profitable. Like, if we're just being honest, they want you to be profitable in corporate offices. You get more different types of things on your schedule. You know, we're doing more preventative work. We're staying up to date with the brand new things coming out. Like, there's this new product that just came out. I want to say it's called Curadon. So I don't even know what it's called, guys, but it's amazing. It's basically helping to cure some early signs of cavities, or early cavities that have not reached the second layer of the tooth just yet. And if you don't know, typically the doctors aren't drilling to fill a cavity unless it's in that second layer. Some people do, some people don't, but typically if it's not in that second layer, then they might just be watching it and treating it with fluoride. Now we have like an actual product that we can cure, you know, these early signs of cavities with, and this is new on the market, and the corporate office is already, you know, talking about it and incorporating it. And then, you know, you have all these new things with AI. As everyone knows, in every realm of life, you know, people are using AI. So, you know, this is something new and they're incorporating it. So they're up to date. You stay up to date with your CEs. Your CEs are paid for. Your you know, what do you call it, your CPR is paid for. Like, you know, you get more free products. You have, you know, lunch and learns with people. Not saying that private offices don't as well. It's just in corporate, you know, I think some lean towards corporate more, because they know that, you know, okay, I can go to this office, then I could go to this office down the corner, and then their sister office over there, and you know what I mean. So I like corporate. When I worked in private, I kind of felt a little bit bored with my career. I was just feeling like, am I even really wanting to do this anymore? Like, this is just not for me. It was boring. It was just like prophy. And again, a prophy is just like a cleaning, like a basic regular cleaning. There's no, you know, make this amount of money today. And even though it's not about money, it's just like, you know, it makes you, to me, it makes it a little bit more exciting, because like I have a goal to reach. Because when you're a hygienist, it can be very repetitive. You're just taking x-rays, cleaning teeth, getting the doctor, taking x-rays, cleaning teeth, getting the doctor. So I like to have a little goal, you know, and we have other hygienists, we have competitions within, you know, the corporation, and, you know, we do dress up challenges, like, you know, between offices. We have big mass meetings sometimes. Mass, that sounds kind of evil. I don't know what a mass meeting, but we have like big meetings sometimes where we can all get together, and you'll meet different people that work in different offices from different states, and you can kind of, you know, pick their brains about what they do and how they do things. And it's just, to me, I like it more. I do, but everything is preference. Some people love to just go to a private office, you know, not have to worry about, you know, producing and money and numbers and this and that and the third, and I don't blame them. When I first started, I was like, this is a cult, I'm out. But then you learn how to be ethical about things. You know, you learn that when you're ethical and when you're truthful, you don't have to lie and manipulate to get your numbers and to get to what you need. you really realize like, you know, you really just, it'll come to you, you know, when you're just being real and ethical and, you know, using the systems that we learn in school, and, you know, keeping everything up to date with your patient, checking their gums, you know, and giving the patients things that they need, their fluoride treatments, all these things. You know, you realize that the numbers will just come to you. But yeah guys, that is a wrap to this dental hygiene Q&A. I'm so happy that you are here, that you are watching. Oops, sorry y'all, I done kicked the camera. But I am so happy that you tuned in. I hope that you like this video. I hope that you get a lot of information from it. If you are currently in school, I will just intercede right now in prayer for you and just say, Lord, bless them, bless their grades, lower their anxiety, lower the depression, because I know how it is and I went through it all. Dental hygiene school is not easy. So I just pray for you all that are currently in school, and make sure that you are praying for yourself. Get on your knees, ask Jesus to help you. Ask Jesus and invite Jesus into this journey with you, and just allow him to work it out for you. If you are thinking about dental hygiene school, applying, waiting to hear back, I also intercede in prayer for you, and I ask Jesus, bless the application, Lord, and make a way, make a way, make a way, make a way. And I ask that Jesus prepares you for what you are about to get into, because sis, bro, whoever you are about to get in dental hygiene school. It is the field for you. When you have something in your heart, a desire in your heart, and you pray about it and you put that application in, it has to come to pass. But don't give up. You know, we don't always get in on our first try. Sometimes you have to keep trying and keep trying and keep trying, but you can do it. And I'm interceding in prayer for you all. If you need to private message me, my Instagram, I will put it right here. I'll put my Instagram right here on the screen. If not, you can leave me a comment down below, and just let me know. Also, if you guys have any more questions, I can always do another Q&A video, or if there's something you want to see, I can definitely make a video on whatever you guys need. I am here to help. So yeah guys, thank you so much. I hope that you subscribe to my channel. Stay tuned. And I love you guys. God bless everyone tuned in. Thank you for watching, and have a beautiful rest of your day. Bye.